guys, this is Dr. Hub. Today we are going to look at the brachial plexus block. So under the brachial plexus block, we are going to see some named blocks and looking at the level of blocks and also some other details. So to begin with, we are going to look at the interscalene. So what is the interscalene? So the interscalene, the level of the block is in the superior. It is in the superior as well as the middle trunk. Next is the adequate analgesia. Where is it seen? So the adequate analgesia. So the adequate analgesia is seen at the shoulder and the upper arm. The shoulder. It is seen in the shoulder as well as the upper arm. And the most intense effect is at the C5, C7 dermatomes. So the most intense effect is at the C5, C7. So this has the most intense effect. Most intense effect. This is at the C5, C7 dermatomes. Next is, what are the limitations? The limitations, if you see, it includes the ulnar nerve. It includes the ulnar nerve, that is the C8 and the T1. This is sparing. Next we move on to the supraclavicular. So in terms of the supraclavicular, there is the level of block is the distal trunk and also the proximal division. So the adequate analgesia in case of the supraclavicular, it is seen at the elbow, forearm and the hand. It is seen in the elbow. This is the adequate analgesia. So adequate analgesia is seen in the elbow, it is seen in the forearm as well as seen in the hand. Next comes the topic of limitations. So where are the limitations seen? It is seen in case of the axillary. Next is the suprascapular. And then comes the nerve sparing, the pneumothorax, and phrenic nerve palsy. Next we are moving on to the infraclavicular. So in terms of the infraclavicular, the level of block is at the cords and the adequate analgesia. So the adequate analgesia, it is seen near the elbow, forearm and the hand. Elbow, forearm as well as the hand. So where does the limitation take place? So when you're looking at limitations, it happens in the intercosto-brachial nerve sparing. Nerve sparing. So then lastly we move on to the axillary. So in terms of axillary, the level of block, if you see, the level of block is in the terminal nerves. And the adequate analgesia, where is it seen? So the adequate analgesia is seen in the forearm and the hand. It is seen in the forearm as well as in case of the hand. So this includes the most intense block. So there is a most intense block. So this occurs in the C7 as well as the T1, and this includes the ulnar nerve distribution. This includes the ulnar nerve distribution. Next is the least intense. The least intense is in the C5 as well as the C6 dermatome. Then comes the most optimal this for the procedures from elbow to hand. So let's look at the limitations. So the limitations, it includes the musculocutaneous as well as the axillary. Next comes the cutaneous nerve and the branches pairing. Then is the inadvertent intravascular injection. So this was all about the brachial plexus blocks. To learn and grow daily like this, please do subscribe.